On behalf of Doc Hobby 2020, I would like to welcome you today. For those of you who don't already know me, my name is Dheeraj and I am Bachelor of Medicine and Bachelor of Surgery. Did you know that few things in your life are never asked for, but they come into your life just to make it better? And here I am to do the same. My goal today is to help you understand a little about Staphylococcus aureus. Before going to the outline, I want you to strongly agree with me that medication should never be consumed without consulting doctor in person. Today I will be covering these key points: gram staining, staphylococci, staphylococcal food poisoning. Let's start with gram staining. It's a differential stain. That means it's going to differentiate bacteria by dividing them into two groups, gram positive and gram negative. Primary stain here can be methyl violet or gentian violet or crystal violet. Do comment below which is used in your laboratory. Mordant is Gram's iodine, which fixes dye to the cells forming diiodide complex. Acetone is decolorizer and is used for 2 to 5 seconds. Safranin is counterstain. Gram-positive bacteria have got 100-layer bacterioglycan. And why is that so important? Because gram-negative has got only 1 or 2 layers. That's the very reason why dye and mordant, when added to smear, the diiodide complex form doesn't get decolorized by acetone in gram-positive organisms due to their thick cell wall, and on the other hand, gram-negative organisms loses dye and takes up the counter stain. So, gram-positive stain violet or purple, gram-negative stain pink. This leads to my next point, Staphylococcus. Its gram-positive coccus implies spherical and is arranged in clusters. They produce nascent oxygen appearing as bubbles when 3% H2O2 is added to them. This is catalase test and distinguishes it from other gram-positive cocci. We are concerned only with pathogenic strains, those that cause disease. So pathogenic staphylococci shows coagulase test positive, that is, when mixed with saline and on adding human plasma, clumps are formed. Moving on, let's dive into antibiotic sensitivity test. Add colonies to peptone water to reach a turbidity of 0.5 mg per land standard. Don't worry, the unit is just a measure of bacterial concentration. Now, dip a swab and smear it onto agar, for instance, nutrient agar. Place an antibiotic disc. From the disc, antibiotic diffuses, forming sensitive zone of inhibition if bacteria is sensitive to that particular antibiotic. As you can recall, pathogenic strains are coagulase positive, then what would non-pathogenic be? Coagulase negative Staphylococcus. Here we have Staphylococcus epidermidis and Staphylococcus saprophyticus as main examples. Epidermidis, it's a skin commensal, it's novobiacin antibiotic sensitive, forms biofilm on IV cannulas. So, if cannula is not replaced frequently, they grow and cause septicemia. Now coming to Staphylococcus saprophyticus. It's novobiacin resistant and most common gram-positive organism causing UTI. Now another question. What organism is isolated from your unit culture if you had got tested it before? Next point, culture media. On nutrient agar, which is a simple medium, that is, it grows only non-fastidious organisms. Non-fastidious organisms are those that do not require any special nutrients. Staphylococcus produces golden yellow pigmented colonies on this nutrient agar. Milk agar just provides white background on which these colonies are even more bright. Blood agar is an enriched medium and it is enriched with 5 to 10% of defibrinated sheep blood, and enriched media are the media which grow fastidious organisms. And blood agar is also a differential medium because it differentiates between alpha, beta and gamma hemolytic organisms. And you can call it even indicator medium because any growth in blood agar is indicated by a color change. And in hemolysis, Staphylococcus produces beta hemolysis, that is well-defined clear zone of hemolysis, and it is a complete hemolysis. Mannitol salt agar, salt milk agar, and Ludlam's media are selective media. As salt in first two media inhibits all other organisms, aiding staph to grow, selecting it over others. Mannitol salt agar turns from pink to yellow. Now we'll go into case scenario. So here we have a patient coming to clinic with his hand on abdomen and grimace on face, which tells you that he is in pain and he is even preoccupied by it, as he did not notice the greeting made by the doctor. He described symptoms when asked: stomachache, watery stools, and vomiting, which is probably a gastroenteritis. And it's acute gastroenteritis as duration of sickness is only 1 hour. On asking about his last meal, he says bread and milk in the morning. He doesn't remember when he bought the milk, and it tops our suspected food items list. Less than 6 hours incubation period, with milk being primary culprit, I will think probably Staphylococcus food poisoning. Don't point out at the next statement and say boiling must have killed your accused. The accused might have been dead, but he already contaminated the food with his heat-stable enterotoxin B. Though our doctor strongly suspecting Staphylococcus, he still asked history of travel, antibiotics, invasive bacterial signs like pus, blood, mucus, and stools, which is really important. And on examination, an epibral normotensive with no signs of tachycardia doesn't seem to be severely dehydrated. Anyway, to his surprise, even oral cavity is moist. He just elicited the recent vomiting history, and that itself tells you why oral cavity is moist. Thanks to abdominal pain, doctor still suspects abdominal pain could be due to electrolyte loss. He wants to make sure there are no signs of blood, mucus, or pus in stools, and therefore he does a parental examination, convincing his patient. He wrote a battery of tests, gram staining to detect any organism, but what he found was only our friendly gut commensals. Loeffler's methylene blue and occult blood test ruled out invasive gut disease. Microscopy didn't reveal ova or parasites. CBC with differential will reflect the inflammatory status, proving it's itis. Electrolytes, blood urea nitrogen, creatinine are needed for dehydration status and electrolyte loss assessment. He gave patient 1 dose of antiemetic promethazine to control his vomiting, loperamide syrup to control diarrhea, and oral rehydrating solution to replenish fluid and electrolyte losses. He advised to avoid milk and milk products. He advised on hand and food hygiene, and he advised on follow-up. Opine on the management for the same clinical scenario, and if you can, please mail me your works on cultures or microscopy I described in theory in today's video, and email link will be provided in the description below. Before leaving, use your mouse to like and subscribe and keyboard to comment. Comments are more appreciated than anything. Thank you and see you in the next video. Signing off, Dog Hobby 2020.